Part 2, America Mysterious Virus Outbreaks. According of the Wall Street Journal published on December 1, 2020 by Betsy McKay. Scientists at the U.S. Centers for Disease Control and Prevention found evidence of infection in 106 of 7,389 blood donations collected by the American Red Cross from residents in 9 states: California, Connecticut, Iowa, Massachusetts, Michigan, Oregon, Rhode Island, Washington, and Wisconsin. Across the U.S., according to the study published online in the journal Clinical Infectious Diseases. The scientists based their study on blood samples that the American Red Cross collected between December 13, 2019 and January 17, 2020 and later sent to the CDC for testing to see if any had antibodies to the new coronavirus, which is named SARS-CoV-2. SARS-CoV-2 infections may have been present in the U.S. in December 2019, earlier than previously recognized, the authors wrote. A person's immune system develops antibodies when exposed to a pathogen like a virus to fight it off. Their presence suggests exposure to a virus. In analyzing the blood samples, the CDC scientists found antibodies in 39 samples from California, Oregon, and Washington state collected between December 13, 2019 and December 16, 2019. The findings suggest there were isolated cases of coronavirus infection on the U.S. West Coast in mid-December, the scientists wrote. They also found 67 samples with antibodies in Massachusetts, Michigan, Wisconsin, or Iowa, and Connecticut or Rhode Island collected between December 30, 2019 and January 17, 2020. The scientists said they ruled out the possibility that the antibodies they found had developed to fight off other coronaviruses, which cause the common cold. They did that by looking for antibodies specific to the new coronavirus in 90 of the samples. They said they found antibodies specific to SARS-CoV-2 in 84 of the samples, or nearly all of them. The results add to growing evidence suggesting COVID-19 was present outside of China earlier than previously known. Researchers found the virus, for example, in a retrospective e-analysis of a specimen from a patient who was hospitalized in France on December 27, 2019. Not only did COVID-19 likely appear in the U.S. earlier than previously known, but researchers have found evidence that the virus is far more widespread in the U.S. than testing indicates. Yet, the majority of the U.S. population hasn't been infected. On November 24, 2020, a CDC study published in the journal JAMA Internal Medicine estimated that fewer than 1%, 23% of people in the U.S. had antibodies, depending on the location. Studies show that at least 40 to 50% of people who test positive for COVID-19 have no symptoms. Medical experts say asymptomatic spread clearly is contributing to fall spikes of COVID-19. By Katie Kerwin-McCrimmon, UC Health. Asymptomatic spread has been one of the most mysterious and haunting aspects of SARS-CoV-2, the virus that causes COVID-19. Do people without any symptoms of COVID-19 help spread the virus? The alarming answer is yes. Evidence continues to mount that a large percentage of people who test positive for COVID-19 don't have any obvious symptoms. Asymptomatic spread definitely plays a role in community spread, said Dr. David Beckham, an infectious disease specialist who studies viruses in a lab he runs at the University of Colorado School of Medicine. Let's define the definition of antibodies. From Mayo Clinic, antibodies are proteins produced by your immune system in response to an infection. Your immune system, which involves a complex network of cells, organs, and tissues, identifies foreign substances in your body and helps fight infections and diseases. After infection with the COVID-19 virus, it can take 2 to 3 weeks to develop enough antibodies to be detected in an antibody test, so it's important that you're not tested too soon. Opinion. Based on the Mayo Clinic definition of antibodies, our body requires at least 2 to 3 weeks to develop enough antibodies to be detected in an antibody test. Therefore, the 39 blood samples collected from California, Oregon, and Washington state between December 13, 2019 and December 16, 2019 of SARS-CoV-2 antibodies presence is an evidence of SARS-CoV-2 infections which infected these blood donors at least on November 3, 2019, 21 days prior from December 13, 2019 blood samples collected date. Assuming all these 39 blood donors were infected the COVID-19 on the same day in 3 different states, California, Oregon, and Washington. The odds of all 39 blood donors were infected the COVID-19 on the same day, November 3, 2019, is very minimum chances, especially 39 blood donors are in 3 different states. Possibly, among of the 39 blood donors a dozen or more blood donors were infected COVID-19 in October or September, 2019. Apparently, the COVID-19 have widely spread in US since fall, 2019. I can't imagine how many people have already been infected by COVID-19 in the US before December 27, 2019. December 27, 2019 equals 21 days prior from January 17, 2020 the last batch of blood samples collected date. Let's do the math. If 106 people were infected out of 7,389 blood donors, then the infection percentage rate is calculated as 106 people divided by 7,389 blood donors equals 1.44% of the total pool of blood donors. According of the United States Census Bureau in July 2019 estimate total populations of the 9 different states is approximately 79,026,366 people. Thus, estimate total populations of 79,026,366 people multiply 1.44% equals 1,137,979 people were infected during that period. Even though the calculation of number of people infected during that period in the US may not be 100% correct, however, these numbers are certainly good references. Especially, there are no prevention and protection measures were applied during that time. According of studies show that at least 40 to 50% of people who test positive for COVID-19 have no symptoms. Medical experts say asymptomatic spread clearly is contributing to fall spikes of COVID-19. I can't imagine how many people may already been infected in the US as an asymptomatic COVID-19 carrier. Further evidences, COVID-19 is not imported from any country. SARS-CoV-2 or COVID-19 was first discovered in Wuhan, China with notification to the World Health Organization on December 31, 2019. As more evidence continues to mount that a large percentage of people who test positive for COVID-19 don't have any obvious symptoms. Asymptomatic spread clearly is contributing to fall spikes of COVID-19. Why CDC was delayed 1 year later to publish the result of CDC scientists' study of blood samples of SARS-CoV-2 antibodies result from American Red Cross blood donors. Numerous of publications were published the result of CDC scientists' study of blood samples of SARS-CoV-2 antibodies result from American Red Cross blood donors on December 1, 2020. 1 year later from the blood samples collected date December 13, 2019. Why all U.S. publications mentioned only COVID-19 was likely in U.S. as early as mid-December 2019. CDC scientists report. This statement is totally a misleading statement. The mid-December 2019 referred as the blood samples collected date, December 13, 2019 and December 16, 2019. Were the presence of antibodies of COVID-19 virus found from these blood donors. The approximate infection date of these blood donors is at least on November 3, 2019, 21 days prior from December 13, 2019 blood samples collected date. Our body requires at least 2 to 3 weeks to develop enough antibodies to be detected in an antibody test. Why US have time to publish the first COVID-19 infection was reported on January 19, 2020 in a returned traveler from China in multiple of publications but didn't have time to publish the blood samples of SARS-CoV-2 antibodies result from American Red Cross blood donors. Per CDC scientists said they ruled out the possibility that the antibodies they found had developed to fight off other coronaviruses, which cause the common cold. They did that by looking for antibodies specific to the new coronavirus in 90 of the samples. Further evidence that the mysterious virus outbreaks in Fairfax County, Virginia infected 107 people, 3 dead, 23 hospitalized, dozens, an additional 19 employees, sick as respiratory illness in the midsummer of 2019, outside of the flu season, further proof it is not other coronaviruses, which cause the common cold. There is no evidence that Fairfax County, Virginia mysterious respiratory virus outbreaks is not linked to the coronavirus, COVID-19. All sources of the validity of information are from genuine reports during the incidents, not from satellites images nor personals' opinions.